We've shut these things down for 2 years. This is our place. We like this place, and so now COVID's kind of allowed us to open it up and do these workshops. Most of my new patients have been to them, guests and all that, but and I'm a little rusty. But I want to put something in your mind. The loneliest time in a man's life is when he's born, when he dies, and when he's public speaking. Okay? So nod your head occasionally, just make sure you're out there. I'll try to make this really interesting. We're gonna try to cover several things. Obviously, we're gonna cover chiropractic and things you may or may not know, and how it's affecting your life and what I can do for you. But really, a lot of this is about what you can do for you. This is a time to get healthy. We want to talk about that. I want you on the same page with me, but you got to know what's being done to you. You got to know how I can be effective for your world, but how can you be effective? Louis Grizzard, one of my favorite writers. Anybody know Louis Grizzard by chance? Old enough to know that, from Georgia? University of Georgia. I just happen to be passionate of that. Don't throw rocks. But anyway, he said, life is like a dog sled team. If you ain't the lead dog, the view never changes. So we want my patients and people that work with me to be the lead dogs in what chiropractic is about. We're going to do several things. Obviously, she talked about the drawing, so if you find somebody you think it might benefit from coming to these and getting dinner and learning something, write their name down. We're not going to bug them. We're just going to text them and call them and things on your behalf, and that's it. I'm not here to sell you any things. We've got some offers at the end. Obviously, everybody does that, but it's just I want you to learn something, because this is kind of what I'm all about. Many of you are my patients. Some of you are not. I've been doing this a long time, and I know when you learn what we really try to do for you, it makes sense. All right. So let's get started. I'll try not to talk fast, but I got to get through this because we got to feed you at a good time. We've got this on schedule, so hang with me, pay attention, and we'll get to what chiropractic can do for you, what is chiropractic, pain, nutrition, what you can do for yourself, because I want you to take one thing away from this. If it warms my heart, if you're doing one thing that we talk about tonight, all right? And these are not my opinions. All this is research, so I'll give you a best shot. So agenda, health, what does it mean? I need you to think about, what does health mean? Chiropractic, what is it? We want to cover that. The nervous system, that's what we treat. You need to know that. We don't pop bones. Spine, what causes the injuries most of you come into my office for? They're usually not injuries. They are a long-term thing. It's pain. I doubt y'all can see that. Why you hurt and how you can change it. All right? I said you. All right? So she may be healthy. We don't know. She just may be just happily and have all diabetes. Who knows? But health, what does it mean? Does it mean you don't have pain? Are you healthy if you don't hurt? More energy? What if you have more energy? Yeah, you're probably healthier. No disease? Yeah, you're healthier than the person that does have disease. I agree with that. But briefly about me, she said I've been doing this 30 years and a half. I've studied orthopedics. I did that to make my diagnostic skills better. My story in chiropractic, I was going into medical school. I will say it, University of Georgia. But I'm a Tennessee guy, okay. But I was going to medical school, and they gave me an option when I was with my counselors, and a lot of these options, what do you want to do? Chiropractic showed up on that list. Well, I had been introduced to chiropractic a long time ago with a girlfriend who introduced me to her chiropractor because she was working for him. And he was treating things, asthma, and I remember that, and a lot of other things. Talked to me briefly. I didn't know I was chasing her. So, to be honest with you. But it came back that time. I ended up going to Dallas, Texas, and then in new school, and philosophy, art, and science of what they told me there hit home 30 years later. And I'm very fortunate. I get to say to myself, and I'm still at that stage where I get to go to work. I don't got to go to work. And that's a pretty cool thing. Once I say that, I'm probably through. And I got to chill out and find work at Bass Pro or something. I don't know. All right, what is chiropractic? It's the philosophy. The body has an actual miraculous ability to heal itself, no doubt. You cut yourself, it heals itself. So do all your organs and all the systems we deal with. The body has an innate, a miraculous ability to heal itself, no doubt. We know it. You hear innate immunity, all this immunity talk, innate immunity. Well, that's your body that God gave us to heal it. Art. Nobody can do spinal manipulation except chiropractors. Osteopaths can, physical therapies can't, so it's an art. Science. Science is overwhelming, saying chiropractic is effective and beats any actual medical management. Let's call it low back. All right. What is pain? This is something. This drives you to people's offices. So what is pain? First thing, it's the last thing to show up. Most of the conditions you come to me have been there for 20 years and fix it in 2 days. Tough, but it's the last thing to show up. Fortunately, it's the first thing to go away, and everybody trying to fix that as soon as possible. Boy, I'm walking all over this thing. It's killing me. But anyway, it's the last thing it's the first thing to show up, the first thing to go away. Got that back. The problem is, and I'm going to point this out, it's the worst judge of your health status. If you're going by whether you're healthy or not, or whether you're hurt or not, let's change your mindset a little bit. Everybody, all the healthcare professionals are trying to do that, and this is what we're talking about. Symptoms. It's the warning signal that your body can no longer handle the stress if you're in pain. Or symptoms, numbness, tingling, things down your leg, all these things you come to me for. Heart attack. What's the last thing to show up on a heart attack? I hurt. Right? But you know that it took a while to get there, right? You instinctively know that your arteries didn't get clogged overnight. So pain is the last thing to show up. Tooth decay. We're going to our dentist and our teeth are terrible. Well, it didn't just happen. You didn't get an abscess just the other day. Pain is the last thing to show up, all right? It's the tree with dropping leaves. Do we water the leaves? No. And a lot of medicine, and I'm not bashing medicine or anything like that, but a lot of times we're watering the leaves instead of the roots. Brings me to another quote that I love. Chiropractic is not meant to make you instantly feel better. It's meant to instantly start you healing better. All right, that's my goal. All right. Fallacy of feeling good. The leading causes of death have no symptoms, early symptoms, heart disease, cancer, stroke. All those have no early symptoms. They're late stuff, and you're in trouble when they occur. So health is not about managing you if you're in pain or not. All right? About symptoms. So it's not about symptoms at all. So take that home. I really want you to own that. But let's learn a little anatomy. This is what I do with. This is my world. And listen. There's a test. 7 neck bones, 12 thoracic bones, 5 lumbar. How many neck bones are in a giraffe? 7. Is the word 7? Everybody agree with 7? Well, that's pretty darn good. Most people just total silence. A lot of things. Yeah, all mammals have 7. So yes, 7. All right, so here's what I work with. Now you think you have back pain and that's all we're doing, 2 bones out of. What is the most important organ in your body? Throw it out. Keep coming.
I don't know.
Good. All right, I got it. So I'm gonna move on. Brain, most important organ in your body. Brain. Good job. It's the only organ encased in bone. Controls everything in your body, and the cool thing is, it's the first to form. So if you're going to get a liver, the nervous system's going to control that. If you're going to get a heart or whatever, you got the brain directs the whole thing. It's a computer system. That's why it's encased in bone. Now, I don't treat the brain, by the way. Sort of, but not really. First thing to form. No brain, no life. So I didn't touch it. The second thing to form is your nervous system. And this is an important point, because when you're in uterus and in utero and your nervous system is forming, it is the first and second thing to form, because it controls everything. It touches everything in every way to make it become what it's going to be. So we don't want any interruption to that. All right? We want that thing flowing freely. You have 100 trillion cells in your body. I don't have that many. Height joke. 200 million turnover each day. You're not the same person you were. All right? You get a new liver about every 7 to 8 months. So you're regenerating. Get that point. You're not the same thing, so you can change it. New spine every 7 years. Good treatment plan for me every 7 years. I can't lose. Okay. New stomach lining every 5 minutes. Many times we take Prilosec and all these things, medication that stop this. What controls all this is the nervous system. All right, that is what I'm trying to work on with you. Chiropractors are not bone doctors. I do not fix your bones. I am working on the nerves in between those bones. This is what we work on. This is a chiropractic terminology. 2 bones out of place. Pinching the nerve, all right? That's how you got it there. Nerve interference is how we look at it. Nerve interference causes you pain, numbness, tingling, and no matter what. But that nerve interference can also cause you asthma. 2 bones out of place, red ones, pinched nerve. That's usually what you're coming in. You have that concept with chiropractic. So the nerve interference causes you pain, and much more because that same nerve in that same area handles your whole system. All right, asthma, constipation, bad stuff. All right. So what makes you come in to see me? Cumulative effects. Most of you are coming in, or will come in for things that have happened for years. You put it off, and finally your wife makes you come in. And you want me to fix it in 2 days. Hard to do. But you can see all these these accidents and things of that nature, and we'll go into a few more. Causes of spinal misalignments or subluxation. I get asked this question, well, what happened? Well, auto accidents are a big one. I don't know if many of you have been in auto accidents, but auto accidents can create a lot of problems, and sometimes those, even low speed, 4 to 6 miles an hour can make a major impact on your neck. So don't discount that. In fact, if you get an auto accident and you are my patient, I expect us to see that first thing. All right. Delayed effects. Some of these effects of an auto accident will not occur until 6 months later. I won't go in. That's a whole nother seminar. All right. Other causes of spinal misalignment, and this is probably something you haven't thought of. All of you, some of you got kids and grandkids and all that, so hear me out on this. Birth trauma. Birth itself is a traumatic event, all right? And you just think about it, of how you squeezed out and pulled out and all that. I know you're not eating dinner, so we're not there yet. All right, so the average OBGYN is 170 pounds. The average baby is 7 pounds. So the average pull on a baby's neck, let's say it's a cesarean birth, is 70 to 90 pounds. That's a lot. Forceps, all these things, pulling and yanking on a baby, can cause subluxations of the neck. I get asked all the time, do you treat infants? Well, Lord, yeah, that's the best time. Do I adjust them like I adjust you? No. Okay. But those things can create major impacts, colicky, ear infections. I don't treat the infection. I'm not treating ear infection. I treat this misalignment that can be causing the problem. Fussy babies, things like that. Bad births can cause problems at an early age that I see you now for. All right? So my goal is just to check every spine. Everybody doesn't need me, but I check every spine. So think about that. Remember that in your grandkids if you've got kids that you think you might need an evaluation. Supplements, all right? Misalignments do cause arthritis, early arthritis. You see somebody's spine on x-ray and it's shifted left or right. It's been a long time. and arthritis and spurs and all these things that formed around it. Subluxations cause arthritis. And you say, well, why did you put that? That sounds obvious. Well, it took them a lot of research to actually prove that. Oh, these current costs, they're ridiculous. You know, a spinal fusion's $169,000. You can't see this carpal tunnel, $3,000. Carpal tunnel's a pinched nerve, all right? And that's kind of what I work on, all right? Even asthma, I put that in there because asthma, well, we'll get to that. So here's some pictures. Everybody likes pictures and stuff, all right? So I'll show you this one on the far side over there. That's a bad deal. They're not happy. That neck's going the wrong way. The curve's supposed to be like that. Is it perfect on this side? No, but it's corrected. This person came in with fibromyalgia. You've heard that many times. It's the catch-all diagnosis. Heavy opioid use, a lot of drugs, hydrocodone, OxyContin, pain. Before and after. Well, after changing that neck, the person was off all those medications. Not perfect by any means, but we got him off that road to hell, as I say. All right. So anyway, this one was a kid who has asthma. On the right side is before, on the other one's after. I hope you can see those. I do my best to, that should come up. But point is, his neck is all out of alignment. It's the areas that control his lungs. He couldn't play soccer, exertional asthma, and they had him on everything. So we worked on him. Fine, he plays soccer, comes in every now. I've seen him forever. So that's and it just was because of subluxation interfering with the nervous system, controlling the lungs. All right, it's not that complicated. This one, the girl car accident. The girl they were trying on the right straight neck, beautiful curve after that. She could not bring her neck back. She'd gone through the whole medical profession, said nothing was wrong. It's over. She's just faking it. The big litigation thing got her neck completely changed. She has no headaches. I mean, this girl was like 14 or 15 years old, and they just told her she was dragging it out and wanted some money. But she's fine now. All right. This one has a curve in the neck, which is really common. Some of y'all may recognize it. It's not your neck. But neck pain, upper back, and blood pressure issues. There are blood pressure control centers up in this neck. So the curve's going opposite. It's not perfect, but now it's a whole lot better. Blood pressure, boom, off medications. All right. Chiropractic is pain and much more. All right, and I don't get enough of those cases because I use these forums to actually, hey, you know, there's other things. You know, chiropractors were thrown in jail for that. They never treated neck pain, headaches, and all back pain things you associate with us. They were thrown in jail because they treated everything else. So whether you think that's right or wrong, it's just what it is. This one's a bad one. This one's when in my early days that I was treating pain. She wasn't getting any better, so I sent her to a neurosurgeon. Haunts me still to this day. 6 surgeries later with a muscle stand, the electronic nerve stimulator, she's still stuck over and worse. If I just treated more and done more, I maybe could have done, stopped this. And now her neck's gone haywire, and anyway, the spine's gone downhill. So I don't like those. Those aren't good things. All right, those can happen with backs. Chiropractic in pain, we use spinal manipulation. We do not pop your bones, I do not break your bones, and I do not crack your bones. So please change your lingo because that infers the bone. Okay, I'm working on the joint and the nerve. All right, that's what I'm trying to remove nerve interference. Most of you come in for some kind of nerve interference, wherever that may be. Help the body to heal itself. It has the ability to do that. Be patient. Correct subluxation, masking the symptoms is medications. All right, they cure nothing. They have their place. Not bashing, but they cure nothing. Maintenance. So, if I go to chiropractor, I got to go forever. I never can. I hear all that. And so I'll laugh at myself. How many chiropractors does it take to change a light bulb? It takes one, but it takes 20 visits to do it. So Point is, maintenance is something that's just the most wonderful part of practice because people got it. And we're maintaining. We're at a point you're not dealing with a bunch of symptoms. We're dealing with maintaining where you are. You don't have to be there for maintenance, but my practice is a very wellness practice. A lot of patients on maintenance. I think 50% of our patients probably on, and that makes me feel good. I'm still maintaining number 29 back in 1991. Yeah. So she just, I couldn't get rid of her if I wanted to. You okay? No, I want you to check me out. Okay. So anyway, that makes a joy out of it. 4 frustrations that I have, that I hear, is putting off getting the problem checked. Maybe it'll go away. Covering up the problem with meds and doing everything else. Not following the recipe. Well, what the recipe is you can't hurry nature. There's a recipe. There's get you out of pain, help to correct it, and rehab it. Thus, your responsibility to make it there and go in those phases. It's called a 90-day rule. We're in way too big a hurry. How long does it take for a woman to have a baby? General period. How many months? 9. Why? I don't know. They don't know. All right. A lot of things in life that we don't know that a power up above set that in place. All right. We do not know. We know how it works in every little detail of it, but we don't know why. And we don't. And if your surgeon cuts on you and opens up your heart and puts it all back together, how long is it going to be, Doc, for me to get better? 3 months. Why? That's called the 90-day rule. Pain, things have to remodel, and they have to repair tissues. So that's why, it takes a little time. Don't be in such a hurry for this thing to be well tomorrow. I'm not that good. I try. But, all right, we're going to shift gears. Now we shift in. I told you what I can do for you and what's being done to you. Shift gears. What can you do? Low carb, gluten. Can y'all can't even see that down there, can you? You can? All right. Gluten-free salad and all that. It's just a joke. No diet can remove all fat from your body because your brain is entirely fat, and without a brain you would look good, but all you could do is run for office. Do we see that or what? All right. George Bernardshaw. All right. Why nutrition? We're talking all these mandates and all that. Well, they ought to get rid of sodas, they ought to get rid of sugars and all this and mandate that, and we'd be a lot healthier. But another story. Nutritional value of food is poor. We live in a toxic environment. Bottom line, American diet is very poor. We all suffer from this. Pharmaceuticals, they really do nothing for your health. Otherwise, we should take them on a regular basis like vitamins. They're actually toxins, but they have a role. Again, not bashing, there's a time and a place. Quality of your supplements, is really important. If you're buying supplements from large chains, and I've spent many years on seminars and ad nauseum, you might ought to just eat the bottle and chew on it on some of them. So it really, as far as nutritional supplementation. So there's a big study. I've shortened this, but if you don't smoke, you were not overweight, you're physically active for 3.5 hours per week. Come on, we can do that. And you ate healthily, you reduce the risk of type 2 diabetes by 93%. Come on. That's your control. That's my control. Heart attacks, 81%, stroke, 50%, cancer by 36%. This is their research, not mine. So, changing one thing, if I can have any influence tonight, would warm my heart and do something. So we'll give you some things you can change. Nutrition and pain, 1982 Nobel Peace Prize. I used to do the whole seminar on this. Was about this information here. I'm going to skim through it. You have that in your thing. Yes. By the way, you have that subluxation chart. No, I meant to go to that, but I'm rusty. But you see the top line: corn, cottonseed, safflower, peanuts, soy, canola. Get rid of them. All right, they produce This guy, arachidonic acid, which they discovered in 1982 and won the Peak Prize because they discovered Celebrex, Vioxx, Advil, all these non-steroidals which block that, thus blocking the pain, and we eat them daily and everybody's got them in their cupboard. And we could get heavy detailed, but there are foods that do the same. Fish oils, flaxseed, walnut, more list. Just think about that, all right? So this is what they discovered in order to find out what we have in our cupboard and have made billions of dollars. However, non-steroidal anti-inflammatories the list is long. Some of them are even banned. Here's the problem. You got to be aware of these things. They create this bad cycle. Your cardiovascular risk, that's why they've taken some of these off the market, go up significantly. 41%, you are putting your cardiovascular system in jeopardy if you take these a lot, like multivitamin. Kidney failures, 10% of all kidney failures, delayed muscle healing. Hey, come on, man, we're trying to get you feeling better and you're eating all these like candy and it's not helping. GI bleeding, that's the big one. If you're taking these things, it's like throwing little hand grenades in your GI system and open up little doors where it just leaks out and on and on and on. All right, and it can cause a lot of problems. These are the problems. Even Alzheimer's is listed as, Alzheimer's general neurology. The more you take all these NSAIDs, and because they have a brain effect, cardiovascular blood flow, they can increase the chance for Alzheimer's, among other things. Corn and soy is bad. Processed corn and soy, if you got it from your garden, that's not what I'm talking about. This is, if you can eliminate this from your diet, you're going to decrease your inflammation levels so much. Hear the word inflammation, because everybody that I see has some form of inflammation. Omega-6s are the bad guys. These are the bad dudes. Sick. Remember that, all right? Produce more pain and inflammation. The diet of corn and soy will produce more and more, and then you take more NSAIDs for all that. So if you want to change some dietary things, you'll lose weight. Process corn and soy. The omega-6s, corn and soy, bad guys. Omega-3s are the good guys. More seafood and fish oils. You've heard this, but there's a reason why you keep hearing this. Fish oils, and you got to have a good one. Seafood and fish oil. Omega-3s actually cause death in cancer cells. Cancer lives and functions in an inflamed environment. Okay, if your body's in a lot of inflammation, it will proliferate. We know that. Omega-3s help keep that down. Omega-6s, the more crap you eat, the more we put on here, and all the stuff we eat that's bad. So that's cancer. Brain performance. You want to get your kids' brain performance improving at a young age. Get them off the crap, and that's a big word, I know it, and a lot of things. But even supplement them with omega-3s. Brains are fatty acids. Your brain is a bunch of fatty acids. Omega-3s are fatty acids in fish oil. Omega-6s, bad foods, lower learning ability. So, okay, think about that. Y'all have kids, y'all have grandkids. Eat it. I said inflammation is disease. Inflammation is disease, period. It's not debatable. All these things, osteoarthritis, diabetes, hypertension, obesity, and all those things is an inflamed situation in your body. It's like if you cut your arm and it's red, we'll picture that inside your body, and stuff happens. You have a lot of control over that. And then you get into the COVID, the more inflamed people and all these things, that it beats them up quicker. They die quicker. Food matters. With the right food, medicine is not needed. Whoever said you are what you eat was brilliant. Absolutely brilliant. With the wrong food, medicine is of no use. All right. So, natural pain relievers, things you can do. If you decide to not change your diet, consider some of these things. Medications do have serious side effects. There's not one of them doesn't have 14 side effects, even aspirin. And whoever told anybody that to take aspirin to thin your blood, I haven't seen the research one ever in my life, and I keep up with this stuff that says do that. So I get asked that a lot. Medications have serious side effects. Most supplements, oils, and such don't. So here's just a few. All right. White willow bark, it acts like aspirin. It's better for you. Remember, it is like aspirin, so there are contraindications, liver problems, kids, things like that, but it's better for you. Turmeric, that's a big one. Regular turmeric was discovered for its anti-cancer benefits, but it has powerful anti-inflammatory benefits on let's call it back pain, neck pain, whatever the case may be. Ginger and green tea. Ginger are both great anti-inflammatories. In fact, if you look on that list, you'll see something called oose juice. If you have shoulder tendonitis, and I don't know exactly why for that, make up that concoction for it, and it's fantastic. It reduces tendonitis in the shoulder. Quercetin, you might not be familiar with that, but if you start looking on good bottles of, quote, natural pain relievers, you'll see these. Quercetin, Boswellia, all these reduce inflammation. Long since known over time, and they work. They just don't work immediately. Resveratrol, you got a glass of red wine. Yeah, go, yeah. All right, capsaicin. If you do nothing but put more chili peppers on your salad, you're helping yourself, okay? Nothing, just one thing. Glucosamine sulfate. Who knows what that's really good for? Anybody? Anybody take glucosamine sulfate? Knees, good. Joints, knees, primarily knees. If you got knee pain, you're not taking this, we need to talk. Standard treatment for osteoarthritis, you've heard that term many times. It can protect your cartilage from breaking down. Glucosamine sulfate. If you got painful arthritis, and we'll even focus on the knees, increase your omega-3s, get some good glucosamine sulfate, and consider an herbal combination. And give it time. Don't rush nature. If you increase vitamin D, you decrease diabetes significantly. If you increase your magnesium is a huge one. Not enough in the diet. Nerves, sleep, good Lord, that's important. Creates nerve function. Lack of B vitamins. B vitamins are lacking in our diet. Big one. Homocysteine. You want to find out where you are on your heart attack one? Ask your doctor for your homocysteine levels. Statins, cholesterol lowering. They deplete a lot of stuff. Nexium and Prilosec causes you, what is that? Magnesium and B12. I don't have all this memorized. I'm rusty. Okay. So think about that, and I've given you in that a list of things. If you are taking certain medications, what does that deplete in your body? That's a good foundation to say, okay, I need to take that. I need to take that and such. A lot of older people ask me that. Basic supplementation. Just basic. You got problems you want to deal with, we'll talk about it. Quality multivitamin, and I use the word quality. 2 per day, no copper. You do not get enough vitamins in the food you eat. Fish oil is a really high quality one, all right, and you got to take a lot of it to really make an impact, but if you take a little and start and do it a long time, that's good. Inflammation. Vitamin D3, that's the superstar. Y'all heard about vitamin D3 lately? I've been preaching this 15, 20 years. Good Lord. It's the superstar. If you find one you're going to take, okay, your wife lays them out or whatever, I'll take that one. And they're little pills, and 5,000 IUs is where you want to go per day on that, and that's still low. Magnesium, that's a big one. More magnesium will help you sleep better, your nerve function, great for restless leg syndrome. Makes a lot of things work better in your body. K2 and K7, K2 and K7, you may not be familiar with those, but those are anti-plaque. They help stuff not stick to your arteries. And if some of you have seen on your x-rays, we see the arteries with a lot of plaque on there. So these may be warranted. Anti-inflammatory foods, you got a good list there, a good printout, but just change your oils you cook in. Extra virgin olive oil. That's it. That's one thing. Turkey, chicken, egg, all these pretty things, if God made it, eat it. If man got a hold of it, look at the label, because there's probably stuff in there. Add quality supplements. Processed corn and soy from your diet. If bad cooking oil, dairy, we're the only people that still eat dairy, only species, after we're weaned off of it. All right. Sugars and wheat, those are two killers. If you can decrease your sugars, you're going to lose weight, and I guarantee you're going to feel better. Again, one thing. All right, so there's some things you can do. Now, I put this up here because we're going to address CBD. That's a big question I got. It was bigger a little while ago. It still remains high on people's things. But you got to understand, if you ask your medical doctor, most 95% of fit physicians were not taught the ECS system. It's about what CBD does. It's over 3,000 studies and more. Just keeps flowing in. It's legal in all 50 states. You're not taking something like we did in the 70s and all that, you know, chill out. It's legal. These receptors, it activates receptors in your brain and in your immune system and in your body. We have more CBD receptors than anything. It's a system that's been known a long time. It improves your immune system, and it does not substitute like a medication does. It helps your body work better and decrease inflammation, period. So I won't go, the things you got to know if you people are buying it elsewhere, yeah, we got some, but I ain't trying to say there's no best one. There's really good ones. And the good ones are third-party tested. You should be able to ask the guy for a lab report where you go. I doubt they can produce that in a pharmacy or a Walgreens, all right? CO2 extraction, you must ask that question. That is the safest and best way to do it. $1 or $2 more, but purity levels is great. Organic, yes, that matters. You start pouring chemicals on it and all you're doing is doing the same thing a Monsanto's doing. Full spectrum, that's a really good one. Full spectrum gives you most of the effects of CBD. There's an isolate which means all the THC is removed. So if you have any worries about that, the isolate is the one you want to go. Full spectrum is the most beneficial. The entourage effect is a whole discussion, but all these things work it has everything in it to make it work better. Vitamins, minerals, all those are in there. Isolate, I said that if you want all THC is removed. So that may give you some education on that. Here's what we know about CBD. It reduces inflammation. Inflammation is disease. Any help you can get helps. Works to improve homeostasis. Maybe not a familiar word, but your body is always in homeostasis. If something goes down, it brings something up. It always is trying to keep balance. It's when homeostasis goes crazy is when you flourish in disease, whatever that may be. So it helps achieve that. Reports from our office, I've got people improved sleep, my wife. Thank the good Lord. Tremors lessen, Parkinson's, tremors lessens. Decreased pain, blood pressure decreased, arthritis, anxiety. Anxiety's a big one. Headaches, a lot of reports. That's just from when they're in our office. So more on CBD. Is it safe? Yes, it's an oil. It's just like sunflower, olive. It's just a fatty acid oil. There's no side effects unless heavy usage. And I mean, you about to drink a lot of bottles of heavy usage. Is it safe with medications? In your liver, there's a P450 enzyme that metabolizes most all your medications. So CBD is also metabolized there. The only two that they really recommend, let's just lay off this, it's not real concrete, are blood thinners and epilepsy drugs, all right? Because it works with the brain, all right? Does not cause dependency, and does it have a positive drug test? No, unless you don't know the label and unfamiliar source. Cops and all that, we don't even go in that, man. They just won't let them do it. And okay, fine. We're not even going to talk about that. Someday they'll come around and help them because cops have a lot of back problems. All right? So they want to be on this. The most researched thing you'll see for CBD are headaches, top of the list, migraines, chronic pain, addiction, fibromyalgia, arthritis, irritable bowel syndrome, insomnia, PTSD, stress, big one, and your tremors associated with Alzheimer's, Parkinson's, and such. I got a guy off that 16 years VA guy that hydrocodone every day for 16 years. He was scared to death because they cut him off. Cut him off. He knew he was addicted. The only thing that got him off that, we discussed this, he went heavy down the CBD route. It wasn't easy, but he would tell you if I stood him here today that's what made the transition. So I'm glad to see him off of it because VA's taking all that away. If you take CBD, start slow and go slow. You reevaluate about every 2 weeks. Most people start seeing things better in 2 weeks, but I recommend a 3-month supply. If you're older, you metabolize slower. Know that. Start with less. A general rule, no matter where you go and what you get, start with about 30 milligrams per day. Find the sweet spot. I know my sweet spot. I take it every day. I got stuff going on in here. You guys beat me up for 30 years. And the dosage can be decreased over time. It's not something you've got to forever take. All right. Finally, so sorry, I'm sure you're tired. Oh. Make chiropractic a piece of your healthy pie. I'm not everything, but it's not enough piece. A lot of times chiropractic should be the entry point, and I'm the last resort, and you've tried everything in the world, and you're so burnt out on the medications and physical therapy and such. It's when it should be the first portal of entry. I'll send you where you need to be if you need to go there. Every spine should be evaluated. That's kind of been my goal throughout time. Every spine should be evaluated. From cradle to coffin. Don't wait for pain. You wait for pain, expect some work to be done. All right, to reverse that process. Change your diet. You can change your life. I've seen so many miracles in over 30 years. Change your diet, change your life. It's just a matter of up here. It's between our ears. We know it. Anti-inflammatory supplementation. Now, here's some things if you want to get them from our office, because everybody asked me to put these together. It's like 5 things. It's a 3-month supply of those things I told you. You can get it for $150 if you want them. All right. Health certificate. If you want anybody as a new patient that's a guest in here, you want to see me, we'll do all these. Can't do it free. It's $50. It's up to you. This just comes. And there's also one. This one. Immune support. I can't call it anything else. Okay? Immune support. This is getting real big. What do I take? How can I prevent? What can I do? Reduce your inflammation. And if you want to talk COVID or whatever you want to do, we'll talk about it. It's opinions, and I'll try to give you what I know.
Restless leg and magnesium.
Yep.
Is there anything like with adjustments that can help restless leg?
If it is neurologically based, if it's chemically based, then you need to handle the chemically. But yes, some of them are neurologically based, which is spine, middle of spine. So yes, but some can be. Most of the restless leg syndromes that people suffer with at night are chemically based. So that needs to be handled chemically. There's neuropathy and all those things that can be a part of it. But if it's chemical, then we need magnesium, potassium, calcium sometimes can be needed also. But if it's neurologically based, yes, chiropractic can help in conjunction. Anybody got any more questions or anything like yes? Fire away.
You said the vitamins. You said vitamin K2, 4, and
K27.
27.
Yep. Very common thing. It's the most recent thing. It helps stuff. Again, it helps stuff not stick. All right. Now they are anti-clotting, so you got just talk to your medical doctor about that. I have to preface all that because but K2 and K are really becoming more popular. How they can help stuff not stick to arteries. They do other things, but we're deficient in that, and that's why it's becoming part of the regimen that kind of we recommend for everybody. Here's the baseline. Unless you're the greatest eater in the world, you who is? Come on. Okay. Yes, ma'am. So anybody wants to come see me. Otherwise, what do I need to announce?
The guest
But so if you've got